Tuberculosis of spine, also known as Pott's spine. Now, TB spine is always secondary to primary infection elsewhere in the body. Tuberculosis of spine is of four types: paradiscal, central, anterior, and posterior. What happens in paradiscal is bacteria lodges in the area and there is erosion of vertebral margins and destruction of the ivy disc. It loses its nutrition, hence degeneration occurs and there is complete disc destruction. Central destruction is in the center of the vertebral body, so the body collapses. In the anterior kind of Pott's spine, there is erosion of anterior part of the vertebral column and the pus travels up along the anterior longitudinal ligament. Posterior elements of the spine is destroyed. Coming to the clinical features, there is back or neck pain according to the area involved, localized pain, structural change of the vertebra. The person may present with scoliosis or kyphosis. There is cold abscess underneath the psoas sheath and groin. Malairs, anorexia, paraparesis or paraplegia according to the involvement of the tuberculosis. There is weight loss and spinal movement is limited. Moving on to the diagnosis, we do the X-ray where we can see the diminished space of the vertebra in between the vertebrae. So there is diminished IV space. There is wedging of the vertebral body and we can also find the retropharyngeal abscess. Now in cervical spine TB, a retropharyngeal abscess may be seen on a lateral X-ray. So where your pharynx is pushed forward and the soft tissue shadow is shown in front of your C3 vertebral body. We can also see the psoas abscess where the shadow of psoas is swollen. The other tests to be done is MRI, your biopsy, Monto test, ELISA and chest X-ray.